India has achieved a major milestone of 10.22 billion square feet of registered green building footprint. India has become the second largest country in the world in green built area. From the places we stay, work, study, transit, play and worship. The green building movement is spreading across the country as India is witnessing enormous development over the next 5 decades. Going green and net zero is the only way forward. With the rich experience of over 2 decades, IGBC launched Mission on Net Zero on Earth Day 2021, which is in alignment with the Government of India's commitment of India becoming a net zero carbon emitter by 2070. We invite every citizen of our country to join the green and net zero building movement spearheaded by IGBC and make India the Jagat Guru in sustainability.
Good morning, everyone. We'll very shortly be starting with the third day session from today. So just give me about 2 minutes. The speakers are on their way. I request all to please be seated. Thank you. A very good morning to all, and I welcome you, a very warm welcome on the CII-Exim Bank Conclave on India, Africa Growth Partnership, Creating One Future. The theme for the session today is on the health initiatives, the partnership pertaining to health. May I request the speakers to please come and take their seats. So we have with us today Mr. Mehir Niranjan Chaya, President Designate Bharat Biotech International Limited, Dr. Sandeep Devan, Director Critical Care Medicine, Fortis Memorial Research Institute India, Mr. Nikhil Diogar, Vice President Tata 1mg, Dr. Abdu Mukhtar, Director Industrial and Trade Development, African Development Bank, His Excellency Dr. David Musabaya, and His Excellency Dr. Kalambi Shandgula. I welcome you all, and may I request Mr. Mehir Niranjan Chaya to be the session moderator for the session and give the opening remarks, please.
Yeah, so good morning, everybody. Your Excellencies, distinguished dignitaries, all ladies and gentlemen in the room, a very good morning to all of you, and thank you for making time to attend this session, from which we hope that we can take away measurable outcomes and a way forward. I have the privilege of chairing this session, the India-Africa Health Partnership. The connect between the public healthcare and economic prosperity has become increasingly evident over the years between India and Africa. Currently, India is a primary provider of affordable generic medicines in Africa, and being from the pharmaceutical and the vaccine sector myself, I've seen it over the last 30 years, right from my early days in Ranbaxy and Alembic 2, now Bharat Biotech, especially during the COVID period when vaccines under the vaccine Maitri were supplied to Africa. During the pandemic, India demonstrated its commitment to global health by providing essential medicines and made in India vaccine, for which we are very proud, Covaxin, to various African countries. This act also showcased India's ability to support healthcare systems in those countries. Today, we would like to explore avenues for partnerships, together, whether we can forge partnerships, creating ground assets in Africa, localization of manufacturing, bringing markets much more open to Indian medicines, data exchange modalities between regulators, way that we can have a sustainable go forward with the African healthcare market in India. From January to March 2021, Africa received a significant number of COVID-19 vaccines manufactured or formulated in India, especially under Vaccine Maitri, that was initiated by Honorable Shri Prime Minister Narendra Modi. A total of 24.4 million vaccines were delivered during this period of COVID to African continent. Out of these, 8.4 million vaccines were commercially given to Mauritius, Morocco, Egypt, Algeria, and South Africa as part of commercial arrangements. More than 1 million vaccines were provided as an international grant to 17 African countries. And under the COVAX initiative, approximately 15 million vaccines were distributed to 26 African countries. This is over and above the India's own pressing needs to vaccinate its own population. And we have seen during the COVID, the discrimination, what we call as the vaccine discrimination that developing countries faced in terms of ability to import specific raw material for vaccines, cornering of procurement contracts. And during this point of time, the developing countries came together and supported each other. And this period made everybody realize the need to strengthen partnerships in which the partnerships become autonomous and independent of any arm twisting that can go along in future when such pandemics come about. Indian companies have a significant role to play in augmenting the health-related infrastructure of African countries, and therein too the financing models that are available for such kind of partnerships will become more and more valuable, specifically if key products and services for this kind of partnerships are evolved, especially by ADB. By sharing knowledge and best practices, Indian companies can assist in the establishment of healthcare institutions that cater to the specific needs of African communities. In the context of Africa's economic growth and development, it is essential to recognize the crucial role of healthcare investment. Without adequate investment in healthcare, economic development becomes challenging. As of March 31st, 2021, the Indian Exim Bank has provided credit lines to the tune of $1.6 billion to various healthcare projects in various African countries. The financial support demonstrates India's commitment to supporting healthcare infrastructure and initiatives in Africa, which are vital for promoting sustainable development and improving the well-being of African communities, and our support continues on a sustainable basis. African governments could also look to provide certain incentives and create a conducive environment for collaboration to attract Indian expertise and resources. For example, if biotech or vaccine manufacturing localization, say under the GAVI plan, up to 247, if 40% is going to be localized of the 100% requirement by Africa, if there are offset agreements that African Union gets together and decides for giving to localized companies or localized vaccines with certain, what we say is the African manufacturing premium, which will help Indian entrepreneurs to move some part of their capacities to Africa, where currently our cost of goods manufacturing is much better, and that would incentivize manufacturers to invest locally. As per evidence, India ranked as the third largest investor in Africa's healthcare sector between the last decade. In fact, India's share of investment amounted to around 19% plus of the total 1.1 billion. And majority of this FDI from India has been directed towards establishing general medical and surgical hospitals, accounting for around 82% of the investments. Diagnostic laboratories took around 15% share, and residential care facilities took around 2% of the share. The role of Indian government in supporting the pharmaceutical industry's expansion into African countries is crucial. Through policy support, financial incentives, and most importantly, diplomatic engagement, the Indian government can facilitate the engagement with the African counterparts in the pharmaceutical sector. This support can enhance collaboration, promote technology, transfer of technology, strengthen R&D partnerships, and this part is very crucial if the African continent is looking over a period of time to become more and more independent in their pharmaceutical, vaccines and biological requirements. R&D in Africa is also an area where R&D institutions can be set up, and that needs to be promoted. Ultimately fostering a sustainable, and this is the key word, whatever initiatives taken, they have to be sustainable, fostering a mutually beneficial healthcare ecosystem between India and Africa. With this, I rest my opening comments and we start this session. And may I request Mr. Vinod Devan from Fortis. Let me just make sure I pronounce the names right. Can I get the speaker's profile? I'll just like to say a few words about the speakers. Pardon me, but let me introduce you to the speakers briefly. Yeah. So the first speaker would be Dr. Sandeep Diwan, who is the founder and managing director of eNext ICU and the director Department of Critical Care Medicines of Fortis Memorial Research Institute. Dr. Diwan is a pioneer of tele-ICU telemedicine platforms and runs one of the largest ECMO programs in India since 2014. Dr. Diwan.
Thank you, sir, for the kind introduction. Dear Excellencies, distinguished guests and friends, very rarely you will find a doctor in the forums where healthcare partnerships are being talked about. But I am somebody who is somebody coming from the ground, reality, and the reality is that 40% of our patients right now in most of the corporate hospitals in India are international patients. So that means we are already catering to a huge sum of patients who are coming from outside India, and let me tell you, a lot of them are from Africa. And that only signifies the fact which the moderator sir has already highlighted, that we are getting a lot of patients. That's mainly because of three reasons. The reasons I feel is the knowledge gap. So the first thing that I want to discuss is the why do the patients come to India? Because we know that the Indian doctors have a good credibility. They have very good skills all across the world. You go to US, UK, you find some of the top-notch doctors in the world are Indian doctors. Even in US, even in UK. So that means there's already a proven fact that, and there's a study, and I'm not speaking on my own, there are medical journals which have published that if you get yourself operated by an Indian doctor, your chances of accuracy and survival are much better. Now this is actually a published study in medical forums. So this is where I think why the patients are coming, because there's a knowledge gap. So the first thing I think which India can offer to Africa healthcare is the knowledge transfer. We know that the doctors in India are good, but is there a way we can forge a partnership where doctors and nurses from Africa can start coming to our bigger hospitals and start learning those skills which we have learned over the last 20 years? Yes, it's a possibility, but at this point of time, this possibility has not been explored at all because of the fact that most of the time patients are very happy coming here, but it's a lot of cost to the patient. I'll give you an example. A critical care patient flew from Kenya. On the way, this was for a modality called ECMO. On the way, the patient had a cardiac arrest and they had to fly the patient back to Kenya because the patient couldn't reach Delhi. A lot of patients can't reach India, so there's still a lot of deaths which must be happening in Africa because of lack of infrastructure and knowledge transfer. So we can offer our services to doctors and nurses for training in critical care and particularly in those surgical specialties for which the patients are coming to India. The second partnership which I think can be done is digital connect. We all learned during COVID that digitalization has a huge role to play in actually joining the world, and the same has happened in healthcare also. Pre-COVID, we never heard the words like telemedicine, tele-ICU, tele-neurology, tele-pathology. Only tele-radiology was an accepted form of medical practice, but post-COVID, the telemedicine has come in a big way. Most of the governments have published telemedicine guidelines, including Indian government, and now telemedicine is a very recognized form of practice in India. So I'm sure during COVID, all of you would have interacted with your doctors on phone, because a lot of the times there was physical restrictions, patients couldn't reach hospitals, so it's time now doctors reach the patients. So telemedicine can actually bring super specialists from India right to the hospitals in Africa. Right now, a lot of patients have to get their pre-operative evaluation. For this, they have to come to India. For post-operative follow-ups, they have to come to India. For major surgeries, they have to stay in India for 4 weeks, 6 weeks, just so that they can do adequate follow-ups with the doctors. A lot can be done through telemedicine. And when your colleagues are connected with us to telemedicine, the first part which I was telling is knowledge upgradation will happen automatically, because the doctors there are interacting with us. The super specialists in India can guide the doctors on management protocols. The clinical situations can be managed much better, and the most important betterment can be in field of emergency medicine and critical care. Because I am a critical care specialist, so I would want to speak 2 minutes. In trauma, what we do in first 1 hour decides whether we die or we survive. Even before the patient reaches the hospital, your death warrant is either written or you have saved, because pre-hospital care is equally important. So creating a robust emergency medical system is of paramount importance if you want to save critical patients. We all heard in COVID, everybody was looking for 2 things. Obviously vaccines, oxygen, ICU beds. This is the only thing we were all looking for. So that means there's a huge gap still in the infrastructure as far as emergency and critical care departments are concerned. And this is the first touch point of every patient. If you help a patient in emergency, they will actually remember you for the rest of their lives. So emergency systems, complete grids have to be created, which can easily be done through telemedicine platforms, and India with its expertise can give a lot to Africa. The third thing which moderator sir has already mentioned is infrastructure upgrades. Every doctor needs a certain kind of infrastructure, a certain kind of laboratory, a certain kind of radiology and modalities so that we can perform better. And that is why I'm standing here. Can I perform without my tools? No. So even the best doctor cannot do anything if he is not given the tools to perform. So I think creating better healthcare facilities, creating laboratory, because we receive patients from Africa. Unfortunately, sir, 50 to 60% of patients can be diagnosed there, but probably if we can upgrade the laboratory services, the radiology services, or other form of platforms for which they don't need to come to us for simple tests, for simple pathologies. Yes, for complex treatments they still need to travel for a transplant or something like big, but I think secondary care, tertiary care can be provided in Africa because of better infrastructure upgrade. Now how do you upgrade? We have seen that there are certain good institutes in Africa who are doing very well also. I have been traveling to Kenya to see patients few times, but few hospitals in Kenya are doing extremely good work. So I think there's a potential there. There's a huge gap that is already existing. We are already helping our African brothers in pharmaceuticals, in vaccines, and that everybody knows. But I think it's better now we come to the services. So overall, I would want to end by I think summarizing in 3 areas where the partnerships can be forged is knowledge transfer, upgradation of healthcare infrastructure, and getting our doctors, super specialists, to actually manage patients in Africa rather than they coming to India through the means of telemedicine. Thank you very much, sir.
Thank you, Dr. Diwan. We now have Mr. Nikhil Doegar, who is the Vice President of Tata IMG, Tata 1mg, and I think most of the people in the room know Tata 1mg as one of the pioneers in online pharmacies, and they now have a majority share in the Indian market, close to around 2,500 million volume per month, which they are catering to. And it's an area where Tata MG is also pursuing policy with the government of India for online pharmacy legislation, which we hope matures very fast.
Thank you. Thank you, Dr. Devan. I think today I would like to touch upon the use of technology like Dr. Devan talked about and how that is making a difference in the healthcare space in India. It has fastened the pace of healthcare accessibility and affordability in India, and some of these or a lot of these practices have a lot of relevance in terms of what is happening and what can be done in Africa as well. Over the last decade, through the use of digital platforms and other initiatives, there has been a marked improvement in the distribution of healthcare, both primary and tertiary, across all of India. Some of these have very real and practical application in Africa. The use of technology has not only brought transparency in the healthcare space and empowered patients to be in more control of their conditions and treatments, accessibility and affordability of medicines, and particularly the diagnostic space, both radiology and pathology, where it has just become that much more accessible. Hospitals are more accessible today. It has improved drastically as the pace of innovation has increased. It's very important that we realize the extent of innovation which has happened over the last few years and the impact which has had on the end user, the patients who are out there and impacting their lives. To give some instances, as we saw during the COVID pandemic, and Dr. Devan touched on that, tech platforms like CoWIN, for example, it enabled nationwide vaccination at a scale which was not imaginable at all before, and it was built in record time. I mean, we didn't have a platform when the pandemic hit us. It was developed, it was made ready, and it was actually implemented across billions of users. Arogya Setu was another app which helped us do that. Now, all of these are platforms which we built over the last few years, and these are platforms which are very, very powerful. And we believe that healthcare is a universal problem, and any intellectual property or any IP which we have today is something which can be shared globally and made use across the globe, including in Africa. Public-private sector partnerships have helped make medicines and healthcare facilities reach the remotest parts of the country. I mean, there are areas which are very difficult to reach, areas which are beyond access for a lot of people. I think healthcare facilities, by the use of technology, have, like was mentioned, that through e-consultations and digital platforms, they're able to get access to that. Indian healthcare startups are driving innovation across the ecosystem. There are startups which are there in pretty much every space now. We at Tata 1mg started the journey about 9 years back, but over the last few years, that's just the whole scene has just exploded, and there are lots of startups which are currently working on various problems across the industry. So that's another area, and I think the key to all of this innovation and development is internet and mobile penetration. As that has increased and as users have become more and more mobile friendly, a lot of the services have actually reached the patient's doorsteps. Medicine delivery, diagnostics delivery, where today we have phlebotomists who can come to your home, they can collect your blood samples, and you can get testing done and the reports uploaded on your mobile app. It's something which was never imaginable a few years back. So I think a lot of that innovation has happened. We at Tata 1mg have been fortunate to be part of this growth story. We've always had a vision of making healthcare accessible, understandable, and affordable for everyone. And we've been just fortunate to be part of this technology revolution. For our friends in Africa, the digital health partnerships with the Indian health ecosystem can help faster leapfrog in the healthcare access to areas that are otherwise hard or expensive to reach or serve. In India, we've developed platforms and models, like I mentioned, that have that kind of relevance. So in order to move forward, we can think of 4 key areas that can be leveraged. First is technology partnership. like I said, leveraging innovation, which is already demonstrated in the Indian healthcare space, can be a driver change. Digital platforms have gone through a cycle of understanding customer and patient needs, because it's very important to understand what people in different demographics, people in different regions, people in metro and tier 1 cities versus the remotest part of the country, what they require, and then be able to serve them accordingly. We believe that the applications which have been developed are universal, and a lot of these platforms can be taken through digital partnerships to Africa as well. A lot of it is already happening, but I think a lot more can be done to take it over there. Beyond technology, the second area is knowledge sharing. So there are ample case studies, not just on the technology side, but in terms of what is being done, public-private partnerships, startup ecosystem, solving different use cases like diagnostics, radiology, pathology. What is being done in different areas, just knowledge sharing around that can be very impactful. There can also be seamless access to Indian healthcare expertise. For example, e-consultation platforms. I think it's a very powerful feature where not just for primary care but also for second opinions. We've seen in India, particularly in the remote areas, there's a lot of adoption of patients who take their first opinions from their local doctors and their regular providers. But in case of doubt, they do need a second opinion. And a lot of times we refer patients from the remote parts of India to institutes like FMRI and AIIMS and PGI Chandigarh or hospitals like that. So it's a lot of burden on patients to be required to travel that much, go through that whole series of diagnosis, stay there and come back to their home cities. All of it can be done digitally today. At least a lot of it can be done digitally today, which is something which is very powerful. So that is one. Second is medical tourism, like was mentioned. I think that's also useful. So the user or the patient comes to the actual hospital on a need basis as and when required, but all the primary diagnosis can be done remotely. And lastly, business partnerships, also figuring out what business models work, because it's also not all public sponsored, it's also public-private partnerships, private companies like ours who are driving a lot of this innovation. What kind of business models work and what kind of infrastructure is required to enable these kind of initiatives that can be shared across the board. So just to summarize, we have a firm belief that access to healthcare is a universal problem. It's not one country's problem. It is something where innovation should be shared globally. And if we have the right infrastructure and the right partnerships in place, this can only help us achieve all our goals faster. All right, thank you.
So that was sharp on time, 7 minutes, 30 seconds to the last second. That's great. So now, after telemedicine, investment in basic primary, tertiary, in secondary, tertiary diagnostics in Africa, online platforms, e-consultations, we now come to a key part, which is financing and cost-effective financing. And we have Dr. Abdou Mukhtar, who is the Director, Industrial and Trade Development of the African Development Bank, Côte d'Ivoire. Dr. Mukhtar, prior to joining AFDB, was a Group Chief Strategy Officer of the Dangote Group of Industries in Nigeria. He started his career as a medical officer at the Ministry of Health in Kano in 1991, and then was a research associate at the Boston University Medical Center in the United States. And he was also profiled among the outstanding scientists of the 20th century, second edition of the 2000 outstanding scientists then, and now he's a financier. So he has been on both sides of the table, and we are hoping to squeeze you dry of the interest rates from AFDB, so please be prepared. And he returned to Nigeria in 2003 following a 2-year tenure as a management consultant in the Bureau of Public Enterprises. Dr. Mukhtar, please.
Thank you, Mihir. Ladies and gentlemen, good morning. A lot of excellent points have been made, really, so I don't want to repeat many of the things, and I know Mihir is putting a very close tab on the time, so I have my iPhone here to also time myself. make sure I don't stay over time. But look, I want to start from one of the things that you said, right? That to have any meaningful economic development or social development, you need to focus on health. Health is wealth. Everybody knows that cliche. So because of that, we understand that in the African Development Bank, and that's why we prioritize in healthcare. We have 5 priority areas in the bank. One of them is improving the quality of lives of Africans, and that's why healthcare and issues around education, sit very squarely. We also have one of the priority areas, industrialization, and that's why we handle issues around pharmaceutical and vaccine manufacturing, which is one of the key areas we try to push when we talk about industrialization. Now, a lot of challenges in Africa around healthcare. I don't want to repeat too much of them, but Africa with 15% of the global population has 50% of the deaths from communicable diseases, infectious diseases. 50% of the deaths around the world is 50% Africa, even though Africa accounts for only 15% of the world population. It's estimated that Africa loses $2.4 trillion in annual output due to poor health. Minimum investments required to meet the health needs of Africa every year is projected to be about $26 billion. Right now, we only spend $4.5 billion per annum. So that's only 17% of the healthcare needs in terms of financing actually spent. So because of that, the African Development Bank, we came up with a response. We developed 2 strategies. The first one is called the Strategy for Quality Healthcare Infrastructure in Africa. And the second one is a pharmaceutical action plan for Africa. And the vision for this is that by 2030, we'll be able to achieve certain objectives. In terms of the healthcare space, we're looking at, the idea is really to improve access to quality healthcare, to achieve SDG 3, the Sustainable Development Goal number 3, and Africa Union 2063 agenda in global health. And there are 3 pillars for that. The first, and some people have talked about this, is the healthcare infrastructure for an underserved population. So to provide basic infrastructure, many of the primary healthcare health centers in Africa lack basic, water supply, sanitation, energy, power is a big problem, communication services. So that first pillar is actually meant to address that. And we have specific programs and initiatives and financing to address that. Second is a focus on secondary and tertiary facilities. So the idea is to develop these facilities, secondary and tertiary, but also specialist centers for cancer, for dialysis, pain management, and things like that. And the last one, the third pillar, is diagnostic infrastructure. This is really huge, and the reason why many people come to India and other places really for medical care is because they want to make sure that the diagnosis is right in the first place. You need quality infrastructure for diagnosis to be able to do that. I met an interesting entrepreneur a few days ago with my team, O'Neill right here, who is actually doing some diagnostic facilities, developed some technology around cervical cancer, which is really being tested already and used in India. And we're partnering with that entrepreneur and that company to see how we can roll that out across Africa, because cervical cancer is the second largest killer of women in Africa. So tied to this is a number of cross-cutting themes. ICT connectivity, very, very important. We're supporting a lot in ICT, so telemedicine, very, very important. My dad passed away 2 years ago. He was 95. Towards in the last few months of his life, we actually benefit from a lot of telemedicine consultations with Indian super specialists, and that was very helpful. And we can only imagine how much difference it will make if everybody can have that access, within Nigeria. Now, shifting to pharmaceuticals, which is one of the key areas. Now, in Africa, we import 70% of the essential medicines that we use on the continent. 99% of vaccines consumed in Africa are actually imported. We produce only 1%. This cannot really be sustained. And COVID, if anything, really opened our eyes to the challenge and to the problems that this can pose. So with that self-sufficiency in mind, not necessarily an import substitution play, but also the need to address Africa-specific diseases, because let's be real. Africa, we have things, Lassa fever, Ebola, those kind of things, nobody really is interested in those because these are Africa-specific diseases. So there is a need to focus on those kind of diseases. Because of that, we're trying to push significantly local production of pharmaceuticals, and the goal is to reverse that by 2030. So we want to be able to, through various instruments, to be able to produce by 2030 in Africa 70% of the medicines that we consume, and tied to the Africa CDC vision, ambition to produce 60% of vaccines that are produced on the continent by the year 2040. We have various ways and means around which we're trying to do that, and I'll just mention a few. The first one is money. So I hear you talk about money. Money in the African Development Bank is not a problem. We have $221 billion in market in capital. We're dedicating to spend from now to 2030 at least $3 billion to develop the pharmaceutical sector. This is money that can go directly into private companies, whether they are African companies that are trying to localize, or these are foreign Indian companies trying to set up operations or expand existing operations in Africa. We have this money. We'll be happy to support it. Second, the issue of regulations. One of the key problems in the pharmaceutical sector is the lack of regulation. You need to harmonize regulations. So we are working with the AU to establish what we call the African Medicines Agency, which is the one agency that will certify drugs across the continent. That AMA, the agency, has already been established in Rwanda. We're providing financing to support that so that we can harmonize that. We're working with countries to increase skills development. And in that regard, we're actually tapping into Africans in diaspora. In the United States alone, where I live most of my time, 20,000 Nigerian doctors actually practice fully certified in the United States. So we're trying to find ways to attract those doctors back, either through telemedicine or find some way to link them to hospitals and centers in Africa. I know I'm running out of time, but technology is one area where we are also supporting. So we have a very comprehensive work that we do in the African Development Bank around pushing technology, supporting 4IR technologies in particular. In Rwanda, you'd be surprised to know that 50% of the blood transfusion that happens in Rwanda is actually transported by drones. They have a drone port in Rwanda. This is a zip line in partnership with Rwanda. We're already supporting similar expansion in Ghana, in northern Nigeria, and a couple of other places. So these are all the things that we're trying to do in the bank, and we'll hope to do more. So Indian companies, opportunities, please partner with us. I'm here with my colleagues. Come to us. We want to see what you want to do. We believe that you have the right know-how, the right R&D, and the ability to locally produce and achieve and help us achieve this vision. Thank you very much.
Thank you. So that was just 30 seconds extra. That's fine. If you are going to, if you have a $3 billion layout, 30 seconds is okay. Right? And African Common Regulator, AFMR, right, is certainly, we are looking forward to hear more about it, because that will be critical. In fact, it could be a game changer. I have now the honor and privilege of introducing to this August forum His Excellency Dr. David Musabaya, who is the Deputy Minister of Foreign Affairs and International Trade for the Republic of Zimbabwe. His Excellency is the MP for Hausa North Constituency and is the Deputy Minister of Foreign Affairs and International Trade. He has served as the Minister of State for Provincial Affairs in the Mashonaland East Province, Zimbabwe. He holds a doctorate in business leadership from the London Business School, a master's in business administration from the Nottingham Trent University, and a Bachelor of Science honors in economics. Wow. University of Zimbabwe, and a chartered accountant. He's got and from the Chartered Institute of Management Accounts, he did his CIMA in 1995. So he's a passionate entrepreneur who founded the Kingdom Bakeries and Riga Land Private Limited in 2002. He is in an agribusiness venture, an experienced finance and investment professional. Sir, welcome, and I invite you to provide us with your address.
Thank you, Mr. Moderator, for the very kind introduction. I guess most of the critical issues have already been highlighted, and from the introduction, I was introduced as an economist, and as an economist, our focus largely is on trade issues and the supply chains and the value chains. So in looking at areas of cooperation, especially in the medical, in the pharmaceutical, and the health field, it is critical that we quickly draw lessons from thus the COVID-19 pandemic and also the supply chain disruptions that were occasioned by the Ukraine-Russia conflict. Those are testimonies of how it is important to relook and rethink at our supply chains. We know the economists had always been advocating for lean manufacturing, lean thinking, or lean philosophy, where we focus on just in time. But this was put to, and also we were also convinced by our founding economists that nations must concentrate on areas or on activities or production or areas of their comparative advantage. But now, after the disruptions caused by COVID-19 and also the Ukraine-Russia conflict, we've realized that regions, countries, need some level of self-sustainability. That's where I will premise my discussion on areas that we need to target. So as Africa, we are a fragmented continent. As a fragmented continent, there are challenges with infrastructure. Power or energy is one of the key infrastructure that is a challenge. And one may ask, why am I talking about power? We are talking about health, we are talking about pharmaceuticals. But we are saying you can have a beautiful hospital, you can have beautiful equipment in that hospital, but there is no power. There are issues to do with water. You need water in hospitals, but we have situations where there's no water in a beautiful hospital. So it becomes a white elephant. So we are saying one of the target areas that we need to look at, we had a financier who was just speaking just before me. We need an integrated approach when we are funding any health projects in Africa, where we are saying beyond the digital technologies that would have supplied, we must make sure we have adequate power. We must make sure there's accessibility to that facility. We must also make sure that there's access to water in that facility. So those are some of the areas that we need to focus on when you're looking at the gaps for cooperation in Africa. Then the other issue that we want to look at is the issue of the transport infrastructure. Some of the roads are not, areas are not accessible. Again, my predecessor spoke about the use of drone technology that has been adopted in Rwanda, which is now closing the gap. So we also need to look at those areas, issues around infrastructure, to say if we are going to come up with a solution, whether they are digital technologies or pharmaceutical manufacturing plants, or even the value chain or supply chain of medicine that we are creating in a community, is there accessibility? So those are some of the challenges that we have. Then we also have medicine that require cold chain in its transportation. When you are transporting medicine, that has to be refrigerated. Again, you need facilities. But Africa, in most parts of Africa, they may not have those facilities. Then lastly, I want to talk of taking advantage of the Africa Continental Free Trade Agreement that has been put in place. Someone alluded to issue of policies, policy rigidities, differences in policies, where we are saying different countries have different policies that can act as barriers to entry of certain necessary pharmaceuticals. But we are saying with the Africa Continental Free Trade Agreement, so how can India partner with Africa and cooperate and close the gap? So it is Zimbabwe's opinion that what India needs to do is to come and set up in Africa. Setting up in Africa where they do joint manufacturing. Joint manufacturing of pharmaceuticals. Because once you do joint manufacturing of some pharmaceuticals in Africa, it means they now qualify on rules of origin. They can penetrate the rest of Africa, thus accruing economies of scale. We'll be able to accrue economies of scale, that's reducing the cost of production. And we're saying this is not something new. China did a cooperation with Indonesia in the manufacturing of vaccines. It was a very popular, where a state-owned pharmaceutical biopharma and the China Sinovac Biotech, they partnered and they produced the vaccine, which made Indonesia part of like a hub for the production of vaccine in East Asia. We are saying India can also set up a model where they can come in as a company, create a company in Africa. When they create a company in Africa, there will be part ownership where the African firm, the Indian firm may own a certain percentage, and the African partner can own a certain percentage of the shareholding. Again, this is not new. We know Toyota Motor Corporation entered India in 1997 in a joint venture with the Kisloka Group. Toyota Motor Corporation holds 89% of the share, and the remaining 11% is owned by Kisloka Group. And this is based in Bidadi, Karnataka, near Bangalore. So this is again another functional model where we are saying instead of Toyota Motor Corporation producing in Japan, they've moved into India. They formed a company and they have a joint partnership. So I believe these are the possible partnerships that we are looking at in Africa. Why? Because we are saying as long as we have medicine being produced in India, because of logistical challenges, supply chain disruption, supply chain constrictions, and also the financing challenges that Africa also faces. We have challenges where the medicine is traveling a long distance because of poor budget cycles. There are situations where they are failing to submit their bids for the tenders for the medicine, and they miss their tenders, and because of that, we create a lot of shortages. That's why we heard of those statistics of high death rates in certain areas in Africa. So we believe the areas that we need to target when partnering with Africa are areas where the medicine is bulk, where we think the transportation is an issue. So we need to make sure that we form JVs, a strategic partnership in Africa. In Zimbabwe, we have come up with a framework where we now have created a special purpose vehicle that was established so that this special purpose vehicle will ensure that there is a platform for joint manufacturing and also for strategic partnership. This was made through the Medicine Control Authority of Zimbabwe, and also we created a distribution channel of the NatFarm. And so the pharmaceutical manufacturing strategy has been set up from 2021 to 2025. And we're saying we're looking for strategic partners so that we produce in Africa and distribute in Africa. But we may still import the important ingredient from India, I submit.
Thank you, Your Excellency, and my apologies. I mispronounced your full name. It is Dr. David Musabayana, and I said Musabaya, so my apologies, I correct that. And thank you for your speech. And but apart from being an economist, you're also a politician, so 1 minute extra is allowed. It's not an issue. So it gives me great pleasure to introduce His Excellency Dr. Kalumbi Shangula, who is the Minister of Health of the Republic of Namibia, and he serves as the Minister of Health of Social Services of Republic Namibia and has been involved in a lot of healthcare initiatives for the Republic of Namibia and also representing Namibia in a lot of international organizations. Minister.
Thank you very much, Director of Proceedings, Your Excellencies, distinguished guests, ladies and gentlemen. I'm honored to stand here before you on behalf of the government of Namibia at this historic 18th CII-Exim Bank Conclave on India-Africa Growth Partnership. Namibia has strong ties with India that date back to our pre-independence period. It is satisfying to recognize that our relations continue to grow from strength to strength. The recent visit of the Minister of External Affairs of India to Namibia and the signing of important agreements during this visit bears testimony to these excellent relations. Access to good health and well-being is a human right and an essential component of sustainable development. Unfortunately, progress towards goal number 3 of Sustainable Development Goals has been adversely affected by the COVID-19 pandemic globally, continentally, and at country level. This impact was greatly felt in Africa, where access to medical products and technologies was severely constrained. Namibia is a large country occupying an area of 824,292 square kilometers. It has a population of 2.5 million and a population density of 3.16 persons per square kilometers. It is located in the southwest part of Africa, between South Africa in the south, Botswana and Zimbabwe in the east, Zambia and Angola in the north, and the Atlantic Ocean in the west. Namibia is classified as upper middle income country. It has an excellent road and communication infrastructure and a stable political environment. The official language is English. The government of the Republic of Namibia is committed to universal health coverage. Public health sector has been one of the beneficiaries of the largest government budget allocations since independence. The public health sector consists of 1,200 outreach points, 283 clinics, 44 health centers, 30 district hospitals, 4 intermediate referral hospitals, and 1 national referral hospital, servicing 85% of the population. The remaining 15% is serviced by the private sector. On average of 1,200 different product lines are actively procured, warehoused, and distributed by the Central Medical Store every year. The split between the products is 55% pharmaceuticals and 45% clinical items. The ministry has adopted and implemented a pool system from facilities. This means the facilities determine the replacement quantities they need and place the orders to the central and regional medical stores, supported with a predefined delivery schedule per region. This allows the facilitation to be in good control and actively This allows the facilities to be in control and actively manage their stock and prevent stockouts. The ever-growing number of health-seeking populace increases the demand for provision of medicines and clinical supplies. Distinguished guests, allow me to share with you a few investment opportunities that you can explore and take advantage of in Namibia. Namibia is a net importer of most of all, if not all, of its health products and consumables from other countries, including from India. Hence, investment opportunity exists in the development of pharmaceutical plants for the manufacturing of generic drugs, antibiotics, and supplements. India can explore several investment opportunities in the health sector in Namibia. So allow me to highlight some of the potential areas for investment. Number one, pharmaceuticals. We know that India is a very strong pharmaceutical industry and can consider investing in the production and distribution of pharmaceutical products in Namibia. This could include setting up manufacturing facilities, establishing distribution networks, and supplying affordable generic medicines. Healthcare infrastructure. Namibia can benefit from investments in the healthcare infrastructure, including the construction of hospitals, clinics, and diagnostic centers. Indian companies with expertise in healthcare infrastructure development can consider partnering with Namibian counterparts in participating in infrastructure projects. Medical equipment and technology. India is known for its advancement in medical equipment and technology, some of which has been articulated this morning. Investing in the supply of medical devices, diagnostic equipment, telemedicine solutions, and healthcare IT systems can contribute to strengthen Namibia's healthcare delivery and diagnostic capabilities. Capacity building and training. India has a well-established healthcare education system. Investing in capacity building and training programs for Namibian healthcare professionals, including doctors, nurses, and technicians, can help enhance the quality of healthcare services in Namibia and in Africa at large. Traditional medicine and Ayurveda. India has a rich tradition of alternative medicine system like Ayurveda, collaborating with Namibia to promote alternative medicine practices, establishing wellness centers, and sharing knowledge and expertise in this field can be a potential investment opportunity. Health tourism. Namibia's natural beauty and wildlife attracts tourists from all over the world. Investing in medical tourism infrastructure, including wellness retreats, spa resorts, and specialized medical services, can tap into the growing market of health-conscious travelers seeking rejuvenation and medical treatment. Research and development. Collaborating on research and development projects in the health sector can lead to scientific advances, innovations, and the development of new treatment or technologies. Indian companies and research institutions can explore partnership with Namibian counterparts to foster research collaborations. It is important to conduct thorough market research, assess regulatory requirements, and establish partnership with local stakeholders when considering investments in Namibia's health sector. Engaging with the Namibian Government Industry Association and local healthcare institutions can provide valuable insight and opportunity for collaborations. Similarly, medical consumable products such as protective apparels, gloves, syringes, and the likes are all in demand. Reliance on import of such goods create delays in supply to the health facilities. There is only one pharmaceutical plant that produces limited range and quantity of medicine and clinical supplies in Namibia. Investor can establish a pharmaceutical plant for local production or enter into joint venture with local partners. Advantage of a local pharmaceutical plant include elimination of costs associated with the importation of medicine and clinical supplies. Import permits will no longer be required, delivery time will be minimized, and the company can participate in preferences for local production. In addition to investment opportunity in the health sector, Namibia has taken a strong step to mitigate the effect of climate change. Namibia has positioned itself as the renewable energy hub of Africa, with the best solar radiation, wind, and seawater availabilities. A green hydrogen hub is being developed. Last month only, an agreement of $10 billion investment was signed between the government and the Hyphen Energy and its partners to develop green hydrogen commercially in Namibia. Namibia is rich in natural resources, including rare earth minerals, lithium, copper, iron ore, and granite. Our government has decided to limit the export of raw materials and promote value addition in the country so that we can create employment and alleviate poverty. Again, agriculture is one of the sectors that India is very strong in. And as such, I invite those in this sector to explore investment opportunity in the agriculture sector of Namibia as we embark on import substitution of food products for self-reliance. We invite you to come with technology and help develop our agriculture sector for local consumption and export to the wider African market through the African Continental Free Trade Area Agreement. Namibia offers the best location to invest in because it is a country that's politically stable and peaceful. Investors are protected by law. Namibia has highly sophisticated financial systems. We have unrestricted profit repatriation regime. Namibia is also strategically located to save both your imports and exports through the ports of Walvis Bay, along the road network to Angola, Zambia, Zimbabwe, Botswana, South Africa, and the Democratic Republic of the Congo. In this respect, Namibia's markets stretch beyond its border into the wider Southern African Development Community, which consists of 16 member states, and to the entire African continent. Director of Proceedings, Your Excellencies, I'm now confident that I made out a case for Namibia. My delegations who are sitting over there are available to provide more information. Please come one, come all. Thank you for your attention.
Thank you, Your Excellency. And out of all the points that you made for Namibia, you said that India's Ayurveda system of traditional medicine, they can partner with Namibia to introduce that in Namibia. I'm sure I will ensure that this message goes across to the Secretary of Ayush, Dr. Kotecha, and I urge CII members also to ensure that Dr. Kotecha gets this message because this is something which is very welcome. Thank you for that. We now close this session. We have exactly 5 minutes available with us to take a couple of questions, hopefully easy questions. But let me just close, give ending remarks before we move to then. The India-Africa Health Partnership holds, as you have seen, immense potential, not limited to $3 billion that Mr. Bakar is willing to provide us, hopefully. And advancing outcomes in Africa by leveraging Indians' capabilities, resources, and expertise. Especially, we need to establish a collaborative framework which has specific outcomes, time-bound deliverables, within a framework which is a mutual win-win. And such kind of documentation is very critical so that such platforms, when we go out of this room, within a time-bound fashion, we have measurable outcomes that which can work towards, and it just doesn't become a nice place to come, say something and go. So this is in the Indian-African Health Partnership. What is required from both sides, Your Excellency and the dignitaries here, is work out modalities with time-bound outcomes by which we can develop frameworks and milestones under each aspect of collaboration. Let us seize this opportunity to forge meaningful partnerships and work towards a healthier future for Africa, India, and thus the globe. Thank you very much. Thank you.
Thank you, sir. May I please request Mr. Meher Niranjan Chaya to hand over a token of appreciation to His Excellency Dr. Kalombi Shangula. Thank you. Can I please request all the dignitaries to rise for a photo opportunity? You can come closer. Thank you so very much. Can I request all the dignitaries to please join us at the Darbar Hall for the valedictory session? Thank you.